So day three, thanks Nida. Thank you for starting the recording. So thank you very much for joining day three. Yesterday, Shimon very kindly walked us through with this ethnographic perspective in qualitative research, the kinds of examples and sharing experience. So today, Najia will be walking you through with yet another perspective, another approach of qualitative, which is the framework approach. Associated with this is the analysis bit and how do you approach this perspective hands-on, and that's the kind of approach that we've at least been using for quite some time in our evaluative research, which includes all the interventions and how do you develop them and how do you process evaluate them, etc. So and a little bit of a disclaimer, I have other things to attend, so I will be coming in and out of the workshop. I have short meetings today, as well as submit something. So I will hand over to Najia. Thank you very much, Najia, for helping us get oriented around this very important approach that you'll be talking about today and a bit tomorrow. Over to you.
Thank you. Pleasure is all mine. So welcome everybody for the third day of our training. Let's keep this day very relaxed and please feel free to ask as many questions. I know some of you have already received training from me about Thinking Healthy program. So I hope you are happy with my style of delivering the training. So today's topic is Introduction to Qualitative Methods, Theory and Practice. First half of the day, we will be looking into what qualitative methods are there, what sort of approaches are there, and that is a very, very brief introduction. And then gradually we will move towards data collection, data analysis, and then we will be talking from the perspective of framework analysis approach. So introductions, we all know each other. We have been together for the last 2 days. So today we will be, we don't need to set any ground rules, but it will be the overview of research design, qualitative research approaches, developing a research question. We will talk a bit about sampling, about topic guides, about how we collect the data, how we analyze it using the framework analysis approach. And some of these topics, at least about the sampling, topic guides, developing the topic guides, data collection, you are aware of. So just see that as a bit of a revision. And if there is something more you can gain out of this presentation, I will go through them quickly. But if you need any further discussion on any of the topic, you can stop me and we can discuss a bit more about it. So the ground rules, basically, if you want to talk, please raise your hand. I can't see all the names on my screen somehow. So if your hand is raised and I have not requested you to ask, please feel free to jump in and ask a question or make a comment. During the activities, I'll appreciate if you will keep your cameras on so that it becomes a bit more interactive rather than me talking to the screen. So we will start now. So basically, research designs are either quantitative or qualitative research designs. The quantitative research design is the process of collecting and analyzing numerical data. So if we are interested in knowing how many, what percentage, how much, then our research is most probably is the quantitative research. And the methods they use to collect data is either questionnaires, surveys, structured interviews, with the aim of gathering a numerical data. And in a quantitative research, the data collection is very structured. And then a statistical analysis is used to derive a meaningful research conclusion. Whereas in a qualitative research, it is the process of collecting and analyzing non-numerical data. And the simplest definition of qualitative research is that the investigation of phenomena, typically in an in-depth and holistic fashion. And it is not it is much less structured as compared to quantitative research. And the aim is in getting an in-depth understanding of the topic of interest. So when you are doing any survey or when you are using a questionnaire, you can't get that in-depth understanding. So the qualitative research helps to explore deep into that specific topic, to learn about people's experience, their motivations, their thoughts, their attitudes. So if we are interested in all these type of the participants' experiences, we need a qualitative research. So for example, if we want to know that what it is like growing up in a single parent family in a rural environment, we need a qualitative research. If we want to know that what are the experiences of people working night shifts in the healthcare, if we give them the survey, if we give them the questionnaire, we'll not be able to understand their experiences fully. So therefore, the qualitative research is very, very important. And it is an overarching term because there are so many approaches which comes under the qualitative research. Mainly, they can be divided into theory-driven research and applied research. So theory-driven research is primarily concerned with either testing any existing theory or generating a new theory. And the most commonly used theory-driven research approaches are phenomenological approach, narrative approach, ethnographic approach, which we learned in quite a big detail yesterday, and grounded theory. So these are all the theory-driven research approaches. So what is phenomenological approach? It was developed by a German philosopher called Edmund Husserl. So it is rooted very much into philosophy. And how the data is collected in this approach is through conducting in-depth interviews with a very small number of people, but they go really deep into understanding their experiences in order to provide a true and valid description of that phenomena. So the researcher who is using a phenomenological approach will collect data and develop a composed description of the lived experience. And this is of interest of people who are health and social work researchers, because that helps them to understand it. So for example, if there is someone who has experienced, say, brain tumor, by having a detailed interview with that person, they want to understand exactly how that person experienced, so that the health and social researchers can then use that information to help other patients who are going through similar experience to improve their services. So Husserl, he believed that in order to understand the true experience, it is important if we put aside all our preconceptions, all our past learning, all our past knowledge. So everything we put aside, and with a very, very blank mind, we interview and try to understand that person from their perspective. So he called that process bracketing. That is when all the preconceptions, all the judgments are filtered out. So this is very different from what we were discussing yesterday and day before yesterday, when we were talking about our positioning, how our own perceptions and judgments and knowledge and experience can impact data collection. So what Husserl wanted is to keep everything aside. So Martin Heidegger was his student, and he chose him as his successor, but he did not fully agree with Husserl's beliefs, because he thought that it is not possible. How can you keep aside all your experiences, all your knowledge, all your perceptions, all your attitude. That is not humanly possible. So he said that in order to describe the experience, your own theoretical and personal knowledge is required. So that is called the interpretive phenomenological approach. I hate this word, by the way. Whereas the Hustler's one is called descriptive phenomenology, because they are just describing the experience, whereas the one which Heidegger proposed was also interpreting that experience. So in order to know more about it, of course, you have to be doing a lots and lots and lots of reading. This is just the brief introduction. So there were other phenomenologists as well. One is Van Manen, and he used method influenced by both Hustler and Heidegger, and he used the term description to include both the interpretive as well as descriptive elements. So there was another researcher who was following this approach, and his name is Gardner, and his approach is called Gardnerian phenomenological approach. And the researchers using this approach, they validate their finding by obtaining feedback from study participants. I know whether it was Prasensa who asked that question yesterday to Suman, that do they also validate their findings in anthropological approach? But this is what is happening here in the phenomenological approach, the Gardnerian phenomenological approach, that they also validate their finding. By the way, I find this phenomena very interesting when you come up with the findings and then you actually take those findings back to the participants to validate it. So any questions so far? No, good. So the next approach, has anybody used the phenomenological approach in any of their studies? No, good. So the next approach is the narrative approach. Again, this narrative has a group of, okay. So the narrative research approach is a group of approaches that typically focus on life of individuals as told by their stories. And usually if we want to learn more about the culture, about the historical experiences, about the identity, about the lifestyles, we use this approach. For example, if we want to understand that how the life of a woman who is living in the village of Pakistan is different from the life of a woman who is living in the urban area. So maybe you can ask your participants to tell their story. What do they do? How do they spend their days? And as the participants will tell them, they will collect that information. Then they can interview another participant who is living in the city and tell them to describe how do they spend their day-to-day living, what do they do to socialize. So it's quite a broad in the topic guide for the narrative approach. It's a very broad question which they ask, and then allow the participants to talk, to tell their own stories. And this is one of the advantage of this narrative approach, because as humans, we like to tell stories. We like to hear stories. We like to tell stories. So this can be, the data collection can be in the form of interviews, or it can be in the form of oral histories, written autobiographies, and biographies. So again, there are different methods which are used within this narrative approach to analyze it. One is the performance analysis. It focuses on the who, what, and why of the narratives. So for example, I have told you my whole story, and when you are analyzing it, you are sort of keeping in mind that who said that, who did that, what happened, how it happened, why it happened. And these like broad questions then help you to analyze the whole story. And another method which is used is the structured narrative analysis. Here, they divide the whole narrative into 6 parts, like when we write papers. So the abstract, the introduction, the complications, which has arisen in that story, the evaluation, the resolution, and coda. Coda is the ending, which is then helping us to understand how the character has changed, what they learned as a result of that experience. So, for example, if I have experienced a bad instance, for example, if there was some accident and I was there and you want to understand how I have experienced it, you ask me to tell that story and how that all that experience has impacted me, what happened, how it happened, why it happened. So you are allowing me to tell the whole story and then analyzing it. So there are benefits of using the narrative approach. Like I was telling you that humans are naturally storyteller. So it is easy to elicit stories. In-depth data is also easily accomplished because when you start telling your stories, you can go in as much detail as you want. You allow the participants to go into as much detail. And then in-depth meaning are gathered as participants usually reveal themselves in their stories. Usually when we ask someone a question, we tend to be asking them, sometimes we tend to be asking them questions, sometimes we tend to be, which can actually interrupt their story. So I think when you are using a narrative approach, it is very much beneficial if you give that space to the participant to talk as much as they want. So any questions so far?
Um, uh, Hello, I'd like to share one of my experience about the narrative approach. It's not it's not really a research. I mean, it's about a biography. So one of the key industrialists, after his death, the company decided to write a biography on him, and they hired me. So this businessman is very different, is because he came from a very humble origin. He started with a small medicine shop, and eventually he became the owner of the biggest pharmaceutical company in Bangladesh and also other sister concerns. At the moment, the company employs more than 50,000 people. So, in one lifetime, he started from such a humble origin and reached to this peak. So I had to take around more than 80 interviews from different category, from business people, from family, extended family. And the interesting thing is I had to write in a fictional style. It's mean, it'll be like a novel. So all the stories will be knitting in a way where that person will be a living character who is interacting with his family and with his colleagues, with his business people. And eventually the character will be portrayed and he will be like, personified. So it's a different experience. Writing is not like a regular research description. So I want it to be a pleasure reading. And many business guides, they also do research on this person, is because he has this business growth. So just sharing my experience. Thank you.
Thank you very much, Nabi. And I bet that must be a very, very interesting experience for you as well, to be learning so much from so many different sources about one person and then integrating it and presenting it as a biography. Yeah. So you did that in Bangla or in which language? Sorry.
It's in English.
English.
But it has not been printed as yet. It's because the editor, and because of the lockdown, the editor is not very well. He got cancer, so he's going through treatment. So hopefully someday in future it will be printed.
Good luck. Excellent. Thank you, Nabi. So another theory-driven research approach is grounded theory. And grounded theory is aimed to build a new theory, a new idea, a new hypothesis. And this helps to understand social realities, how individuals perceive their world, how they interact with each other, and interpret their interactions. For example, how do young women with breast cancer cope with changes to their bodies? So in order to know that, it is important to be listening to that person and collecting the data from them, and then forming a grounded theory. In grounded theory is that the data collection and data analysis are always done simultaneously. So maybe when you are collecting the data, it is guiding you in a way that you want to amend your topic guides. Maybe there are certain aspects which you want to explore more, so you can add more questions. Then you go back to the participants, you ask other participants. So it is the whole process when you are doing the grounded theory. It involves both the inductive reasoning work as well as deductive reasoning work. So once you start collecting the data from the participants, you start building that theory. And then based on that theory, you interview more participants to check whether that theory is right or not, or if there is something more which needs to be added. Any questions so far?
Just
So
a question.
yes, sure.
So is it decided before the interview, before the study even starts, that you are doing this grounded theory, you are taking this grounded theory approach, or while going through the data, you can suddenly decide to come up with one?
Okay, thank you very much, Prasensa. This is a very good question, and that will be answered in the next few slides. This is something which you have to decide before, but we will go gradually into it. So ethnography, we have learned a lot from Suman about it, so I'm not going to say anything. So the first thing, what happened? Yes. So it is the research question which actually guide your approach, Prasensa, coming back to your question. So what is your research approach? What is your research question? And that will help you guide that which approach you are going to take. So for example, there is this researcher who is interested in what constitute the caring relationship between GP and family caregiver in the palliative care for people with AIDS among family caregivers of Pakistani ethnicity in UK. So the best approach he can use is ethnography, because he's going to sit there and he's going to observe the interaction between the family caregiver and the GPs. So another researcher who wants to understand that what is the lived experience of being a family caregiver for a family member with AIDS. So which approach he will use? Because he wants to understand that lived experience, he will use phenomenological approach. And then there is another researcher who wants to understand that how a relationship of trust between GP and family caregiver involve in end of life care for people with AIDS. So he might be using the grounded theory. So therefore, it is very, very important first to develop your research question, because that research question is going to guide you. And then again, as PhD students, you have to give justification for everything. Everything which you are going to do, you have to justify that why you have done it. As long as you have justified it, nobody can object. But if you don't have any justification, your examiners will kill you. So for example, why this first researcher decided to use ethnography? Because he was interested in understanding the caring relationship within the cultural group and to see their interaction, to observe them. He felt that that is the way he's going to get the most richest data, to actually observe their interactions and also to have some informal conversation. Whereas the person who is the researcher who is interested in a detailed description of the participant's experience, he is using the phenomenological approach. And then later he will decide whether he is going to use the descriptive phenomenological approach or interpretive phenomenological approach. Likewise, the third researcher who is using the grounded theory, he wants to generate a theory that what constitutes the trust within this caring relationship. So he is going to use because he wants to generate this new theory. So there are some limitations of theory-driven research approaches. The process of analyzing qualitative data in the above approaches, in the phenomenological approach, in the grounded theory approach, in the ethnographic approach, they are criticized for lacking in clarity and transparency. And the above approaches, they can generate policy relevant findings, but they are not primarily aimed of this approach to generate this policy relevant findings. On the contrary, the applied qualitative research, it uses rigorous method to produce accessible findings. And they answer questions which are specific to research, specific to social and public policy issues. So depending again on your research question, if it is a social and public policy issue, then maybe you are better off using the applied qualitative research. If it is not a social and policy driven question, then maybe you are better off using a theory driven approach. So the applied qualitative research, it's a pragmatic approach. It uses clear and specific research methodology. The analytic process is very transparent. In applied research, time scale is also shorter, usually months rather than years. Remember, Suman was saying that in phenomenological, in anthropology, it can take 8 months, 1 year. So that's a long period. Oh, sorry, Nabi, you have your hand raised.
Yeah, no, I'm just curious to know why, the theory-driven approaches lack clarity and transparency.
Okay, because the way the data has been analyzed, it is slightly different from the way it has been analyzed in the applied research. And when we will go in detail into the framework analysis approach, you will appreciate that difference more. So the framework analysis approach has been developed as a robust approach to analyze data for applied qualitative research, to answer social and policy-driven research questions. And we are going to go into detail about the framework analysis approach, more so in our tomorrow, but we will be talking about it today as well. But in detail, we will talk tomorrow that how we use framework analysis approach to analyze the data. So the most important thing is your research question. So what is your research question? It is usually the first step in any research project. And if you will take it wrong, this is what will happen. So it is very, very important that you spend a good amount of time forming your research question. And a good research question is the one which invites a process of exploration and discovery. Your research question will then decide which approach you are going to take, how you are going to collect the data, how you are going to analyze it. And a good research question, it offers potential for developing new, more specific questions during data collection and data analysis. So from your research question, there could be more specific research question which comes out. And you don't have to worry because this is not the end of the world. It can change and evolve evolve as the researcher conducts the study. So it is not set in stone. We can change it, we can evolve it, we cannot completely change it, but maybe we can slightly amend it. But it is important that we are very clear in our minds that what it is that we want to know, that we want to explore. And if you have a good research question, it do not necessarily produce good research, it can't guarantee it. But what is guarantee is that if you have a poor research question, then there is going to be problems in the subsequent stages of the study. Any questions so far? Okay. So the research questions are broadly divided into 3 categories: explanatory, which are designed to explain your topic of interest. Why do women with perinatal depression attend less antenatal classes? So you want to explain it, that why it is happening. Or it can be exploratory, that you want to explore and understand more about the topic. How communities' perception of perinatal depression potentially influence patterns of treatment seeking. What is the impact of perinatal depression on women's dietary regime? Or you want to describe something. For example, what are the risk factors of perinatal depression? So your research question can fall into any of these categories. So your research question needs to be researchable. That is pretty obvious. Understandable to you and to others. This is also very important, because sometimes what happens is that people who are confused in their minds, they create questions which others don't understand. And then maybe because they don't understand themselves as well. Research question needs not to be too broad or too narrow. And it should have a potential for making a contribution to knowledge. So for example, I have just given some examples, that what effect does social media have on people's mind? So this is not a good research question because it is too broad. What type of social media? Which people? What kind of effects? So when you are thinking of your research question, please make sure that it's not too broad. Otherwise, again, see, this is what will happen. If it is too broad, you will be struggling on who to interview, how many to do interviews, what to ask in the interviews. So the more narrow you will keep it, the more easy it is for you to find the answers. So therefore, even for the PhD topics, it is better to keep them narrow, to make your life easier, to make your supervisor's life easier, to make your examiner's life easier. Keep it narrow. Sometimes the PhD fellows, they can become too ambitious. But then it has the potential of then putting yourself in problem. Okay, the next question. What effect does daily use of Twitter have on the attention span of under 16s? So this is a good question because it is more specific. They want to understand the effect of daily use of Twitter on the attention span. And then also they have specified the age of under 16s. Can you see the difference between the first question and the second question? Good. Third question, where do the majority of immigrants to Germany come from? Now, this is not a good question because it is too simple. And you can simply ask that the straightforward fact that can easily be found online or by conducting a survey. The last question, what are the experiences of Syrian immigrants in Berlin? So this is a good question because it requires data collection and detailed discussions to answer it. So these are some of the examples of good research questions and how they need to be specific, understandable, and they are not broad. Please remember that. So for example, if the aim of my program is to help women in rural Pakistan overcome symptoms of depression during pre and postnatal period, and my research goal is to test effectiveness of the Thinking Healthy program by delivering it to the depressed women during pre and postnatal period through lady health workers. And I am doing the qualitative research. And my research question is that how best I can integrate Thinking Healthy program intervention into existing lady health workers program. So as you can see, that this is a policy-driven, a social and policy-driven research question. It is not too broad, neither it is too narrow. It is understandable to me, and I hope that anybody who is reading it will also understand that what I want to know is that how the Thinking Healthy program can be integrated into existing lady health workers program. Any question? So, okay, so my research question is that how best I can integrate Thinking Healthy program, sorry, this should be program, into existing lady health workers program. So of course, it cannot be quantitative. It has to be the qualitative research design because I want to explore in depth my topic of interest. And because this is a social and policy driven research question, I will be using the applied qualitative research, and in this case, framework analysis approach. It's a very pragmatic question. It's not a philosophical question. It's a pragmatic question that how I can integrate it. Is that clear? Thank you. Okay. I need to move this here. So now comes the activity. I would like you to develop your research question. So this could be your PhD research question or any question you would like to develop for the sake of doing this activity. But when you are developing it, please make sure that it is researchable, it is understandable, it is neither too broad nor too narrow, and it has a potential for making contribution to knowledge. So I am going to give you, will 5 minutes be enough for that? Take your time and please develop a research question. I will be back in 5 minutes.
Should it be done in pairs or just individually?
Because this is the online setting, I mean, you guys could have discussion with each other, but I think unfortunately it's more like a solitary work at this stage. If you have drafted your research question, can you kindly write and post it on this message thing, chat box? So this is just the exercise, so you don't have to be like 100% right. So Nabi has said, identify the facility requirements in delivering through mobile phone a psychosocial intervention for maternal mental health in urban slums in lower and middle, qualitative study. So Nabi, can you, so this is your research title. Can you just formulate it in the form of the question?
Yep, I just posted there.
So you can say that what are the facilitators and barriers in delivering a psychosocial intervention through mobile? Yes. What basic, Pragya has right, what basic qualities are needed for the female community health volunteer to be the THP therapist? Prasensa has said, how feasible will it be for the community volunteers to deliver the Thinking Healthy program to women with perinatal depression? Okay. Okay. Yes, thank you, Nabi. What are the facilitators, barriers, and requirements in delivering through mobile phone assistance? Okay. And Krishani has written, how feasible and acceptable health promoters to stakeholders to deliver. How feasible and acceptable health promoters to stakeholders. Okay. To deliver in Sri Lanka. Okay. Not specific to THP. What effect does the use of social media have on children's mind? Okay. So Nida, you can see that this is a very broad question because we don't know which social media you are talking about. And so you need to be a bit more specific. Maybe you can say the use of a Facebook or Twitter or whatever.
I was thinking about this perspective while writing.
Okay, thank you for these research questions. They are very interesting. And I think these are your PhD research questions as well. Excellent. Good. So, and all of you will be, of course, using qualitative methods. And you have you guys decided as yet that which approach you are going to use? Sorry, Prasensa, we can't hear you. Did you say anything?
Sort of. Yes, we are looking through the framework analysis approach, but haven't decided it yet.
Yes, yes. Good, good. Okay, thank you so much. We'll be working, just keep your research questions in mind because we will be working more on it. Nabi, did you want to say something?
No, about my research question that you asked before. For me, I have two segments. One is about I want to study the perception of slum people towards perinatal depression, like their knowledge, their practices, their attitudes at the moment. I didn't find anything about this in the existing literature. And the other segment will be like what will be the challenges, barriers if we want to deliver a psychological intervention through mobile phone to these slum people. So there's two segments. For the first segment, I'm going to use the grounded theory And for the second segment, I'm going to use the technology adoption model. So it's like two-part. Both are qualitative research. The first one will be the data will be collected through in-depth interviews, and for the second segment will be focus group discussions.
And the first segment will be what will be you want to understand the perspectives of
the perception. Yeah, the perception of Islam people towards perinatal depression, like what they do. We know that the prevalence is very high there, and also, like, but we don't have the real picture, like what they do when they
Nabi,
feel the perinatal depression.
Do you mind typing that question in here, please? The first part of the question. Understand the. Thank you. Thank you so much for writing your research questions. They are all very interesting. Sorry, Seham, do you want to say something?
Pragya's hand's raised.
Oh, sorry, I can't see you. Yes, Pragya. Hello.
I was just curious to know, like, which approach could be best for this research question. So, what basic qualities are needed for FCSB to be the THB therapist? So, I was just curious which approach could be the best one.
Okay. I think this is something which you have to decide. But my PhD research topic was very similar. It was about the acceptability of peer volunteers as delivery agents of Thinking Healthy program, and I use framework analysis approach. But it is very interesting. I think as a PhD fellow, this is the thing. All your supervisors can give you ideas, but the final decision needs to be coming from the students. Yes, and I think this makes the things more interesting, because if they will say, oh, use this approach, then you will not study the other approaches which are available. So by reading all the approaches and then making up your mind is so important, because then when you will be sitting in your viva and then your examiner is going to ask you this question, that why you have used this approach and not this one, you can say by confidence that these are the reasons.
And just to add to that point, Pragya, you raise a very important point. And I think for all the fellows, who are taking up research in one form or the other, be it PhD or otherwise, you need to justify and rationalize whatever design or method or approach that you're using. It will always have some limitations. And at the end of the day, you also need to list down and report the potential limitations. Like I said last week, that there is no piece of research which is perfect. What makes it perfect is reporting the limitations that you already know. So if you venture into using one approach of qualitative, you use a number of data collection techniques, say shadowing, observations, focus groups, or in-depth or key informant interviews. You need to be clear in terms of why this, why not something else. So that's what Najia is referring to. So I'll stop here. Hope that answers this question. Over to you, Najia.
Yeah, thank you, Seham. And Krishani, there are, like, in your research question, there are two things.
Yes, Dr. Najia. Yeah, I was while typing, I was thinking maybe it should be written as two questions.
Yeah, this needs to be two questions, or I think it needs to be more like brainstorming, because how feasible, if we remove the word acceptable, how feasible health promoters are to stakeholders. So that doesn't make any sense. If it says that how acceptable health promoters are to stakeholders, that is making a lot of sense.
Yeah.
But what is the feasibility of using health promoters as the delivery agent of Thinking Healthy program? So maybe they need to be sort of reworded a bit differently, and whether you want to focus on the feasibility or on the acceptability.
Dr. Najia, actually, I started with this acceptability thing. And then later in the previous discussion, I understood that feasibility also something that very important in Sri Lankan context because we haven't done any kind of study on these kind of studies. So, so I thought of
to understand the feasibility and acceptability of acceptable health promoters. To understand the feasibility and acceptability of health promoters. No, sorry. To understand the feasibility and acceptability of delivering Thinking Healthy program in rural Sri Lanka by using the health promoters. To understand the feasibility and acceptability of delivering Thinking Healthy program in rural Sri Lanka through using the health promoters.
Yeah.
So you will be looking both into the feasibility and the acceptability.
Yes.
And again, when I started my PhD study, my topic was very much similar because it involved both the feasibility and the acceptability. And then my supervisor was discussing it with me that how are you talking about the acceptability of the intervention or the acceptability of its delivery agent? Or are you talking about the feasibility of using the health promoter or the feasibility of implementing this intervention? So you have to be very, very, very clear in your minds. Seham, can you?
Yeah, Dr. Najia, actually I am looking at acceptability of health promoters as delivery agents, not the intervention.
Okay. So the acceptability of the health promoters to deliver this program.
Yeah.
Okay. Anybody who wants to make any comment on the research questions which are posted here? So Nabi has posted 2 research questions. One is to understand the slum population's perceptions, attitudes, expressions, pathway to care, impact, etc. about perinatal depression. So again, Nabi, you need to be more specific. I don't think I have never seen the word etc. written in the research question. So maybe you are aiming to understand the slum population's perception about perinatal depression. So the research question, keep it specific, and when you are developing your topic guide, you can ask about their attitudes, expressions, pathway to care, but your research question needs to be like very neat. To understand the slum population perceptions about perinatal depression in Bangladesh or wherever. And Nabi, have you got my point?
Yes, I do. Thank you so much.
And your second question, what are the perceptions?
It's the same. It's the same.
Yes,
it's the same. You know, I put it as an objective and then as a question. Yeah,
okay. We have discussed Nida's research question, and then yes, Prasansa, how feasible will it be for community volunteers to deliver Thinking Healthy program to women with perinatal? Yes. So Prasansa is exploring more about the feasibility of the community health worker, the community volunteer to deliver Thinking Healthy program. Okay.
Yes, and with the acceptability part, it will be more from the service users side.
Yes. Yes. Okay, so Pragya wants to know that what basic qualities are needed for the female community health volunteers to be the THP therapist. Okay. Is there any other way that this can be worded? So actually, Pragya, this is also about the acceptability of the female community health volunteers, isn't it?
Yes.
So you are also exploring the acceptability or the Pragya, I think you need to be working on how to be sort of thinking about your research question, because I think this can fall into the category of maybe too narrow. So for example, if I will give survey to the THP therapists with all the qualities marked in it, and they simply have to take it. So you can do it in that way as well. You don't need to be exploring in depth. So in order to give your study a more depth, you need to be sort of rewording or rethinking about your research question. Sorry, somebody raised their hand.
Dr. Nadia, I'm sorry. Can
Yes,
I ask a question?
Sure, sure.
So actually, Dr. Nadia, this is something I was thinking for a long time. Do you think including both feasibility and acceptability will be too broad as a PhD project? I mean, when why I am asking this is when I go through when I went through this all type of approaches of qualitative research, I felt that maybe the feasibility can go with the phenomenology approach, and the other one can go with the framework approach. Anyway,
I think you will be complicated the things if you will be using two approaches. So for half of your research question, you are using what you said, grounded theory, and for half of the research, you are research question to answer the other half of your research question, you are using framework analysis. I don't advise that.
Okay, thank you.
Please don't do that. I mean, it's slightly different from Nabi, and he must have given it a good thought that why he has decided to use the two approaches. But your is one research question, and to be using two different approaches is not advisable. And
Okay.
Prasansa is looking into the feasibility of using in Nepal. Sorry, and Pragya, where are you based?
Same, Nepal.
Same. So both of you will be doing the same study.
No, this is just for my practice.
Oh, just for a practice. Okay, sorry. Yeah. So I think in reality, one is looking into the feasibility, the other needs to be looking into the acceptability. And there will be lots of overlaps. But I think the best thing is that you can, if you have a research question in mind, you can look for other available literature, and then how they have been approached, which methods they have used to answer similar sort of questions, and that can be a good thing. So to be spending a good amount of time developing your research question is not a waste of time. So Pragya, coming back to your question, what basic qualities are needed for please, Pragya, you need to be thinking more that how you can, this is basically no, so this is a narrow question. You have to broaden it further.
Yeah, I'm thinking, actually, I'm thinking. I think Prasansa wants to say something.
Sorry?
She has raised hand.
Yes, Prasansa.
Just wondering if we have broader research objectives, can we what we are planning to do is divide into specific objectives, and maybe we may have multiple research questions, but we might be using one particular approach to answer all of those.
So like, remember when we were talking about the research question, it needs to be the one from which other questions can come out. Where does it say? Sorry. So a good qualitative research question offers potential for developing new, more specific questions during data collection and analysis. You need to have one broad research questions, but then it can branch out into a more specific questions, which you can explore by adding questions to your topic guides.
So in that case, I just want to echo what Krishani had previously mentioned. So we want to explore the acceptability part from the service user side as well. So would it be then possible to, formulate a question where we have both the feasibility and acceptability components in one research question, and maybe further breaking it down into two?
Yes, you can do that. I strongly advise you to be reading the papers, and there are lots of studies on acceptability and feasibility. So spend some time looking at them, what methods they have used, if their topic guides are accessible. So it will be really good.
Thank you.
So coming back to Pragya again, we need Pragya, something is not coming up in my mind straight away.
Prakash said she will be away for 5 minutes, maybe taking a short break, it seems. Yes, she's here.
Okay, sorry, Pragya. So basically, when I look at your question, no, I think that needs to be, we need to think again.
What prerequisite training are needed for
No.
THP therapist, or what prerequisite? What prerequisite training are needed
You can ask about the perceptions of THP recipients, about the delivery agent or the female community health volunteers who have delivered. So it's more about, you want to understand their perceptions and what makes a good therapist or not a good therapist. So you will be interviewing the mothers, exploring their perceptions about their therapists.
Yeah, that's true. Yeah. That's what I was thinking about.
Okay, thank you very much for this activity. So again, once you have decided your research question and which approach you are going to take, the next thing is that which population you are going to ask those questions. So for example, in the question which I have posed, that how best I can integrate the Thinking Healthy program into the existing Lady Health Workers program, I will be wanting to explore it with the Lady Health Workers program personnel, with the lady health workers, with their supervisors, with the depressed mothers, and maybe the significant family members such as husbands, mother-in-laws. Okay. So for example, now if we go back, where has the chat gone? So Prasansa, who would you like to be interviewing to find the answer of your research question?
Of course, the female community health volunteers and the service users, and also the health workers based at the health facility level who will be supervising the female community volunteers.
Okay.
And the family members of the service users as well, since they will be dealing with the family members while delivering THP as well.
Okay, because when we delivered this Thinking Healthy program through peer volunteers, We linked them with the lady health workers because these peer volunteers, nobody knows about them. So families would not have allowed them to come to their home. So by linking them to the lady health workers, it becomes more possible for them to enter the home and deliver the program. So I don't know the model which you are going to use, that are these community volunteers well established in their communities?
Yes, they are functioning as a part of the health facility.
Okay. So the people who are running that program, you also need to be interviewing them. Otherwise, uh, it will be difficult for you to fully understand that how. Thank you. So what about you, Nabi, who you are going to be interviewing?
No. So as I said, I have two for in-depth interviews. It'll be pregnant women, new mothers and husbands, and it'll be stratified by age, education, and occupation. And for my focus group discussions, I'm planning to include 6 groups, like currently pregnant women, new mothers, husbands, mothers-in-law, unmarried women, and delivery agents. That will include therapists and community health workers.
Okay. Thank you. Thank you. And Neda, what about you? Who you will be interviewing?
Well, Dr. Najia, I think the age group will be specified like school age children of 16 to 13 years, or adolescent age group, to identify and to conduct the focus group discussion with them.
Okay. So again, when you will be doing your PhD, you have to justify that why you are doing the focus group, why you are conducting the in-depth interviews. And again, coming back to that point, Nida, if you would have put here school-going children, that would have made it slightly more specific. Thank you.
Yes.
Krishani, who will you be collecting your data from?
So far, I thought that will be mothers who are depressed and are included in the intervention, and ground level health workers, that is PHMs, whom I will link the health promoters with to deliver the health promotion in the THP, and the adult family members, and also the health promoters who are going to deliver the intervention.
Thank you. Thank you. And Pragya, who you will be interviewing?
That will be same, I guess, FCSB and the supervisor, perinatal woman with depression, husband and in-laws.
Thank you very much. So that has bring us to the next point, which is sampling. Because once we have decided that from whom we are going to conduct the interview, it's not possible to be conducting the interview with all the program personnel or all the lady health workers or all the depressed women. We do sampling. And a sample is a group of people, object, or items that are taken from a larger population for measurement. So, first, you have to decide the setting as well and the situation from where you have to access that potential participants. So for example, if Nabi is doing his research in one particular slum, he has to be drawing his sample from there. And then he will be drawing that sample who can provide the richest information, who are knowledgeable on the phenomena, who can articulate and reflect, and who are motivated to communicate at length and in depth with you. So that is very, very important. And it is also very important to review the sampling plan regularly and adapt it when necessary. So this is something which I really appreciate about the qualitative research, that things are not set in stone. So maybe during that process, if you decide that no, you also want to include these in your sample, then that is very important, I think, before you get the ethical permission. Otherwise, you have to apply for the amendment. So for example, when you are interviewing a depressed woman, you find that Actually, they are completely dependent on their mother-in-laws. They can't do anything. They are not allowed to go out of the house. They are not allowed to even make their own healthcare decisions. So you decide that, no, you also want to interview the mother-in-laws as well. So you include them in your sample. So this is very important. And this is one of the most beautiful things about qualitative research, among many, many others, since I'm a qualitative researcher. So there are different sampling methods. One is the convenient sampling. So here you are asking people who are most accessible. So what are the limitations? That you will not find any diversity in your sample. Or you may not include sources that are best able to shed light. So for example, if you are doing your research on the hard to reach communities, and you have decided to conduct interview using a convenient sampling, so you will not be able to understand the views of the people who are living remotely, who have no access to healthcare, and you are sitting here in the GP's clinic and recruiting those participants for your study to understand the needs of the people who are not there. So it's very important you decide that which sampling method you are going to use and what is your justification. So snowball sampling asks people that they have already interviewed to suggest others that could participate in the study. Again, this method is susceptible to sampling biases. So for example, if I'm doing a research on global warming and I have done interview with Presenza, and after she has given her interview, I've asked her that, can you name anyone else who can give the interview? And then she named her friend. So most likely her friend views will be similar. She will be of similar socioeconomic background as Presenza, similar age, maybe similar views. So my sample will be biased. Then there is voluntary response sampling. So for example, again, I'm interested in understanding more about global warming, and I have put these posters in a college and asking people that this is what I'm going to interview, and people can come. So maybe then only those people will come who are interested in it, or who strongly feel about it. And then I will be missing on the views of the people who are not that interested. But it is important for me to understand their views as well. So it is also susceptible to sampling biases. Any question? So purposive sampling means sampling in a deliberate manner with the purpose in your mind. So it will include individuals possessing specific characteristics. So for example, I want to understand the acceptability of these health promoters. Then I need to be interviewing the mothers who are young, who have only one child, mothers who are educated, mothers who are not educated, mothers who are living in nuclear families, mothers who are living in joint families, so that the data which I collect is rich in information. I have diversity in my sampling. So when you are looking for the diversity, it is called maximum variation. If I will interview only those mothers who are educated, maybe their views are different from those who are not educated, or maybe mothers who are living in nuclear family, their views are different from the mothers who are living in joint family. They have different sort of problems. Those have different sort of problems. So when I'm using purposive sampling, I will be able to include them. And that will end up in my data being more enriched. So you have a research question. You know which research design you are going to use. You have some idea which research approach you are going to use. And then which sampling method you are going to use. So in my case, how best to integrate Thinking Healthy program intervention into existing Lady Health program. I am going to use qualitative research design, framework analysis approach, and the sampling method which I am going to use is purposive sampling. so that I can ensure maximum diversity within my sample. I can interview those lady health workers who have got a couple of years of work experience. I can also include those who have been working for the last 20 years. So that sampling method allows me that, what's the right word, to include as much diversity in my sample as possible. This is a very, very important question, sampling size, because there is no hard and fast rule. People, they do struggle to answer that question. And usually they come up with a number which is between 16 to 24. And there's also a paper which is published on it. And then they see, and then they also say that until the saturation point is achieved. In the PhD studies, usually the interviews which are conducted is 31 or over. In my PhD study, I conducted 32 in-depth interviews. So while there is no hard and fast rule, sadly, you guys will have to justify the number which you have selected, that why you have decided that you are going to conduct an interview with 31 and not 35. And then which means that you will have to be reading lots of published material, justifying your the decisions which you have made. Like my supervisor, she used to say that there is no such thing as a saturation point. She said, what if you will conduct an interview with someone and something new come up? How can you say for sure that there is nothing new going to come up? So these are all things very tricky, but as long as you have done your research, you know why you have decided that number. And when your examiner is asking you that question, you are able to answer that question with confidence, nothing is going to happen. But if you will answer that question saying, oh, actually, I'm also not sure why I have decided, or my supervisor has told me to do that many interviews, that will not be acceptable. Never say that I have done this because my supervisor has said that. You have to justify it yourself. Sorry, somebody's hand is raised. Yes, Pragya.
Actually, Prasansa and I were talking about saturation today in the office, and the data saturation, like while we are interviewing, then my saturation would be different than her saturation level. So how do we come into one point about this?
So about you are going to do your study together? Sorry. Are you going to do your study together?
Actually, this study is of Prasansa's PhD, but I am here as a research fellow to support, to assist her. But we will be, of course, interviewing the people that we have discussed earlier. And I was just brainstorming that about the data saturation. So my data saturation and her data saturation would be different. So how can we come into point? I was just thinking about that.
First, you have to decide the number. So suppose if Prasansa decides that she wants to do an interview with 32 participants. And if it is the same study, sorry, I'm really struggling to understand the question. If it is the same study and you are thinking that, no, actually it's not 32, it will be 40. Or are you interviewing different people? I don't know. But the point is that there is no hard and fast rule. You have to decide if it is a PhD study. Personally, I think that it has to be more than 30. Or then you always write in bracket until saturation point is achieved. So suppose if you have done only 10 interviews and the saturation point you think has been achieved, then that is a bit tricky. What will happen then? In reality, has the saturation point achieved? Or maybe you need to introduce then more diversity in your sample so that some new information can come. I'm not sure if I've answered the question fully, but this is because I haven't understand the question fully.
Yes, Dr. Najia, another question. So when it comes to sample size, so like, deciding for 31 or 32, is it including all the stakeholders that we are interviewing or just one of the stakeholders? So maybe, for example, we will
If
be.
you have conducted interviews with 5 stakeholders, that will be counted as 5, not 1. It will, so you have conducted 5 interviews with the stakeholders, 10 interviews with the mother, so it will be 15. The total keeps on adding up.
Okay, thank you.
And Dr. Nazi, I have a question. Is there any prescribed am I audible? I'm having some internet issues at the moment. Sorry. Am I audible? All right.
There are some breaks between the words, but we can hear it. I think we will understand the gist. Can you repeat your question?
Yeah, sure. I mean, is there any prescribed sample for the same group? How many FGDs I should do?
Okay, focus group discussions. So you want to conduct focus group discussions with the people who are living
for new mothers. Yeah. Say I put 6 groups. Like I'll do a focus group discussion with new mothers, with husbands, with mothers-in-law. So like in one single focus group discussions, how many participants should be there, and how many times I should do the focus group discussion with the same kind of people. You know what I mean? Like with the new mothers, how many times I should do the focus group discussions?
I think
you got my point.
So yes, I got your point. Again, you have to go into the literature. Personally, I think that there should not be more than 8 people in a focus group, but that number can vary. But I think eight is between 6 to 8 is a good number. You have to justify why you are doing the focus group discussions and not the in-depth interviews. If you are conducting interviews with the mothers, say for example, if you're conducting the focus group with the mothers and only 6 women have come in that group, then I think then you need to be conducting more interviews. So for example, if you say that you will be conducting focus group discussions with 3 set of focus group discussions with the participants or until the saturation point is achieved. So you have done 1 focus group with the mothers, then 2nd focus group with the mothers, and nothing new has come up, then you might leave the 3rd focus group. So if you say 3 focus group with each set of participants or until the saturation point is achieved. But again, this is your decision. You have to go through the literature. You have to decide that how many focus groups are conducted usually. Because remember, in the exam, you can't say that your supervisor has said. These are the decisions you have to make and you have to justify.
Thank you so much.
Because I remember half of the time when I used to ask my supervisor any question, he used to ask me, then what do you think? So means that before I ask those questions, I have to have a full knowledge and done my background study. So even when me saying to you that please you can do this is just a suggestion. See how clever I am. I don't want to put myself in any trouble. So 3 set of focus group discussions with each set of participants or until the saturation point is achieved. This is my idea. Okay. So we have already discussed that who you would like to collect the data from and which sampling method you would like to use. So Nabis, you will be doing the grounded, you are using the grounded approach. So which sampling method you are going to use?
I think it'll be purposive sampling. Is because I need the KII who can share with me more, and can open up with me and share the experiences. So
Yeah.
purposive sampling will be, I think, most suitable for my case.
And I think in all the cases which we have discussed, the purposive sampling seems to be the best sampling method, because sometimes people, they have the research questions which carries a lot of taboo with them, and sometimes they have to be reaching out to those participants who don't want to be disclosing themselves if they are doing research on, say, AIDS or the sex workers. Then they use different sampling methods, and then they can justify why they have used it, and even if there are some limitations, but they don't have any other option available other than to use that sampling method. So we have to keep that in mind. Good. Oh,
No,
and
can we mix? Sorry.
Nabil, yes, please.
Yeah, I mean, can we mix like two kinds of sampling? So, for example, I approach with a woman who, while doing the interview, she refers someone who has a kind of experience of perinatal depression. She said she may share more experience with you. Can we mix these two kind of sampling, like purposive sampling with snowball sampling? You know what I mean?
Yes, I know, Nabi. A- as long as you justify it, but usually people, they use one sampling method. Yes. Because if you will choose people, then it can introduce bias. And you will be interviewing the depressed women. Also, in your sample, are you going to interview any woman or the women who are depressed?
No, I'm not doing the screening. So I'll just randomly interview women, new mothers, pregnant women, not depressed.
Okay. So let's give ourselves a break for 10 minutes. Before we have this break, I would like to ask if there are any questions, and how is everybody happy with the pace? Any questions they have? So basically, the purpose of this presentation is to give you some information and to raise some anxiety in you so that you can ask those questions yourself. You can go back, you can read, and then you can gain more information. So as long as if I'm providing you some food for thought, I am happy with it. Any question?
Not a question, Dr. Nazir. Just I was thinking, I was more inclined to qualitative than quantitative. So I'm imagining myself as a more qualitative researcher than quantitative, because, like I said, I'm taking baby step in research. So I'm imagining myself as a qualitative research, but we are doing mix, of course, in our study.
Okay, that's excellent. That's really good. And good that you had that workshop on quantitative as well. So good. Let's have 10 minutes break. So we will be back exactly after 10 minutes. You can look at your watch and do that maths. Good luck. Everybody make a nice cup of tea, coffee, and we will be back. Oh, it says 15 minutes. Nobody. Would you like 15 minutes break or 10 minutes break?
10 should be fine.
10 is fine. Okay, I will change it to 10. Bye. Hello, everyone.
Hello, I'm back.
Thank you, Nabi. Hello, is everyone back? Can
I'm
you
back.
Thank you. Sorry, my background is different. I had to change my room. Who notices the background?
I have noticed.
I love to notice people's background. Good. So everyone is back? Oh, there are 4 chats. Raise hands once back. Thank you. Thank you. Very good. Excellent. Thank you, Siham. Okay. So we have decided the research question. We have decided the approach which we are going to take. We have decided which sampling method which we are going to use. And then comes the process of data collection. So in qualitative research, data collection often takes place in real life situation and often involves direct interaction with the individual. So before we start collecting the data, we develop the topic guide. And it's a document containing a set of areas or broad questions to explore during the interview. So the best way to write those questions is that they need to be open-ended. Like, how did you choose the color for your car? Rather than asking, did you pick a red car? Which color of car did you choose? So when you are developing the topic guide, it's always good to think that, is this question open? Will I get a very good response from my participants? So this is very, very important. You know, one thing which I am going to share from my personal experiences, that spending a good amount of time on developing the topic guide can really help you a long way. Even when you are analyzing the data, even when you are collecting the data, if you have spent a good amount of time. And topic guides also, when you are collecting the data, sometimes we add probes to the topic guides as well. And that probes are aimed to be asking the participant to tell you more, to give you more detail, to elaborate on what they have already said, to give you some examples for what they have said, for any clarification, or to compare some things. And usually the topic guides have introductions where you introduce yourself, you introduce your project, you tell them that why you are interviewing the people. In the introduction, you tell your name, your organization's name, and how long, for example, you have been working for that organizations. And then following that, you give them some time to know about your participant. So you ask them maybe some casual questions about how many children they have, where do they work, how many months pregnant they are. And then gradually you move toward more focused questions. So some specific questions to make them feel comfortable in responding to your topic of interest. For example, how many times do they go for their prenatal checkups? Who accompanies them? Because just imagine, these are the things which appears to us as very normal things, giving interviews. But for somebody who is giving interview for the first time in their lives, they might feel a bit anxious. So as a interviewer, it's our role to put them at ease. And how we are going to do that? By introducing ourselves, by encouraging them to introduce themselves by asking focus questions. So gradually, then we move to the chunk of our interview, which is more related, directly related to our topic of interest. And we ask them detailed, open-ended questions. And then wrapping up is also very, very important. You tell them that the interview is over, give them chance to ask any question, thank them for their time. And then also, this is something which we don't do, that we don't explain to them that what happened next, what we are going to do with this interview. And this is something which is very, very unethical. So the introductions are as important as the endings. We do need to tell them. Any question? No. Okay. So, for example, this is the example of some, sorry, yes, Pragya?
My question is like, if we are doing FGD, then as a researcher, if they say something, can we reflect back what they said, or we just like keep on asking and just noting down as a like note taker can note down, or do we have to reflect back what they have said?
Yes. So one thing which we need to remember, Pragya, is that when we are conducting a focus group, we are not doing a counseling session. So we are collecting the data from them. So you have asked the question, they have responded back to you. If you feel that if you will you will summarize what they have said, and that's going to benefit the other participants to talk more, then by all means go ahead with it. But what you remember is that this is the purpose is to collect the data. The purpose is not to do the counseling with them. So you have to keep those things separate. When I started working, this is the mistake which I made. I was administering PHQ 9 questions and it was taking so long. And then I realized that actually I'm also doing counseling with them, which is wrong. Even when conducting the interview, sometimes I feel that I switch my role from an interviewer to a counselor. So, of course, when you are interviewing someone, you are being empathetic to them, but you remember the purpose is not counseling, the purpose is to collect data. Is that clear, Pragya?
Yes, just to summarize only, but not reflecting back what they said. Okay, thank you.
Yes, yes. Because we will do whatever is appropriate for us to be collecting more data from them. And we don't agree or disagree to them. This is another very important thing. Because in a focus group, if we are agreeing to them, then more people will say the similar thing. So we keep, and if they ask our opinion, because sometimes that does happen as well, that they say, oh, this is what we think, what do you think? Then you simply say to them that I am here because I want to learn more from you. It doesn't matter what I think or what I don't think. What is important is that what you think. Yes, Prasansa?
So in that case, so I tend to paraphrase and summarize a lot when I conduct qualitative interviews. So I just wanted to check whether, like, paraphrasing and summarizing is also needed, or is that a danger sign?
No, that is, if not, you are not overdoing it. So just remember, we need to remember what is the purpose. The purpose is to collect data from them. And if paraphrasing you feel is helping them, then we can use that, because this is the tool which we have, we can use it. But we can't be using it to as much extent as we are using when we are doing our counseling sessions. Because here the purpose is different.
So if we have a set of questions, then for each question, we can, like, after completing each question, can we summarize at that point, or after completing all questions, we only summarize what they have said?
you don't really have to summarize it. You don't really have to summarize it until you feel that there is a need. So you ask them the question, there is, and the questions, you don't have to follow the topic guide step by step. So this is mainly for you as a reminder that these are the things which you need to be exploring. But it should be more like a natural conversation between you and the interviewee. So I always tell this to my team that you are not slave to this topic guide. This topic guide is your slave. You should be using it as you want. Because sometimes people, they become that they have to follow each and every question as it is on the topic guide. This should not be happening. So maybe you have asked question number 1, and in response to that question number 1, they have already given you the answer for question number 6 and 7. Then when you reach to question 6 and 7, you don't need to be asking them again, because that can be boring for them, for you. And when you will be coming to transcribing them, it will be nightmare. If you have asked, it will be taking ages. So you have to be, it's a natural conversation, a person who is asking question and then listening with empathy, but knowing what is the purpose. We should not be start consoling them. We should not be taking side. We should not be saying, yes, you are right, all mother-in-laws are bad, I'm sorry that you have to go through all this. You just ask the question and get the answer. So here are some questions, focused questions from the interview with the peer volunteers. So I have been asking them that how were you approached for this peer volunteer role? What was the first thought which came to their mind when they were offered to work as a peer volunteer? What motivated them to take on this role? What were their expectations from this role? How far their expectations were met? What helped them in fulfilling their role? What barriers did they experience in fulfilling their role? What do they think is the overall impact on mothers after receiving the Thinking Healthy program? What do they think is the impact of delivering intervention on their own self? So I have been exploring different areas through asking these focus questions. And this is very important. Always test your topic guide. You will be surprised that how much change one can make after testing their topic guide. Sometimes people don't understand. And when you are actually conducting the interview, you will find out that maybe the positioning of the questions need to be changed. You will find that, oh, these are questions which you are getting similar sort of response. So you do test it 1 time, 2 times, as many times as it is needed. And then you finalize it. Sometimes we feel that, oh, yes, Nabi?
Do we need to submit the topic guide as well with the research protocol for ethical approval?
Yes, we do need to submit the topic guide. And suppose if you will be conducting your interviews in your local language, then you need to submit both the English version and the other language version.
Okay, thank you.
Thank you. So believe me, like, sorry, I've said this to everything to the research question, but believe me, Nida, you can tell your experience as well, that the more time we spend on developing the topic guide, the richer data we collect and more easier it is for us to analyze it. Am I right, Nida?
Yes, that's very true. Because when analyzing the data, you really came to know that what was the strengths and weaknesses of your topic guide. So you really need to spend more time on your topic guide.
And I think with the experience now, I'm spending more and more time with the topic guide. Before that, I was not giving it as much importance that it should be given, but now I have realized it. Good. Any question?
Prasansa has raised the hand.
Oh, sorry. Yes, Prasansa?
Just wondering, like, we do have conducted pilot testing of our topic guides, and like, so when it comes to data analysis, what we have done so far is we do analyze, include the pilot testing data as well. So like I just wanted to know what you all have been doing and whether it is okay or not to include those data.
No, strictly speaking, when you are doing the pilot testing, that data should not be included in data analysis. That is something different because that all happened before you finalize your topic guide. Okay. So keeping in mind, sorry, yes.
Sorry, yeah, can you do, can you, the sample that you use for pilot testing, can you interview them again for your data collection?
Strictly
No.
speaking, no.
Okay.
So if you have conducted the focus group to test your pilot for pilot testing, that is only for the pilot testing. You can't use those participants again because then you will be asking the same questions. Once we were testing our topic guide for that, the topic was intimate partner violence, and we invited some lady health workers, and the purpose was just to test the topic guide, and the focus group was so beautiful that we were thinking, oh no, what's happening here? So that was a sad part. So guys, you have developed your research questions. So I would like you to develop some focus questions. So this is again a 10-minute exercise. Just think and maybe develop at least 4 or 5 questions, because then in the following activity, you will be doing this interviewing in pairs, where you will be asking some research questions to your partner, and the partner will ask, those, not the research questions, the topic guide questions to you. So 10 minutes, think of what sort of a questions you are going to ask if this is your research question. Thank you. Sorry, once you have drafted your topic guide questions, maybe 4 or 5 or 3 or 4, could you please type them on the chat? Thank you. Hello, everyone. Thank you so much for posting these questions. Okay. So we will start from Krishani's. Can you please explain me? Krishani, are you here?
Yes, Dr. Najia.
Okay, good, good, good.
So,
Everyone is here. Yes, Krishani?
give me a second.
Oh, remember I requested that during the activities, please keep your cameras on. Krishani,
Okay.
if you don't mind.
Okay. Yeah. Sure.
And just to quickly come in, Najia, do we need the breakout rooms, or should I sort of?
Okay. So after this activity, when they will be conducting the interviews, then we will need
Right.
it. Sir. I'm sorry,
Right.
you have to go somewhere, and this is
No.
something which is stopping you?
No. It isn't.
Okay.
It's just that I just have to attend a 15 to 20 minutes meeting with Atif at 11 UK time. So I'll be slightly away during that period. So just type in. I'll be looking into the chat if any inputs are required from my side.
Thank you,
So
Sehan.
over to you, Najib. Over to you.
Thank you. So Krishani, your topic guide focus questions are, can you please explain me how did you get to know the health promoters initially? And what made you decide to participate in intervention led by her? So, okay, these are good questions, but rule number one, never ask two questions in one question.
Okay.
That is forbidden. Okay. So here you have asked two questions, you need to separate them.
Okay.
Next question. What are the qualities you find in the health promoter which led you to participate in the Thinking Healthy program? Okay. So here I'm assuming that it is the health promoter who introduced this program to the mothers.
Yeah. What we are thinking at the moment is we will go to like health promoters will be sent to the PHM clinics, and they will talk about that, and then actually with the support of PHM, but they will introduce themselves and like in that way. Or otherwise they have to go to the community setting and enroll the participants.
Okay, so if this is the health promoter who are also enrolling the participants, then this is a good question, because you need a separate set of activities when you are enrolling someone. You need to have a very good communication. You are a good seller, because it's like, that salesperson, you are selling this intervention to them, and then they will decide whether they want to accept it or not. Is there any other way the relationship between you and health promoter could have improved? Okay.
Actually, Dr. Najia, what I'm thinking at the moment is to uh, go with that theoretical model on framework on acceptability. So I will ask how these health promoters are acceptable in different time points, like in the initially and in the midpoint and also at the end. So this question will go at the end, after completing the intervention.
So here just I was slightly reworded that could there be other ways that the relationship between you and the health promoter could there be other ways that this relationship have improved?
I actually wanted to ask, is there any bad qualities or things that you don't like about health promoters? Then I felt it is like rude to ask in that way. Then I wrote it in this way.
Okay. So you could have asked that, are there any aspects of health promoters characteristics which you were not happy with? So you should not be feeling shy. Of course, you can't be too rude, but you really want to know that. That is an important part of it.
Yeah.
So do ask. Yes. Okay. So Pragya, delivery agent, how did you feel about receiving a session from what qualities did you like most about her? What could have been helping behavior? What did you like most about her? So what qualities did you like most about her? And what did you like most about her? How are they different, Pragya? So this is another thing. With the topic guide, if you are asking the same question but wording it differently, it can put off the interviewee because they have already responded to you. So be careful. Pragya, is that all right?
Yeah, yeah, that is repeated question. Yeah, that's true.
And then again, what did you like most about her? So again, it's the same question, but you are asking the same question, but wording it a bit differently. What qualities did you like most about her? What did you like most about her? Now the last one is different, that what would you like most? Who would you like most to deliver a session? Yes. And maybe it's also important if you ask why.
Yes, yeah.
Okay.
True.
Now this one is Prasansa. Can you please share your experience delivering Thinking Healthy program to women with perinatal depression? So Prasansa, I was reading it actually when I was waiting for others to post. I was thinking that maybe the first question is too broad. So let's try to make it a little bit more specific. Can you please share your experience delivering Thinking Healthy to women with, so can you please share your experience when you start delivering Thinking Healthy program to mothers with perinatal depression? So what was their experience when they started delivering the sessions? And then the following question was there any difference when you started? Your experience was different when you started delivering it till you reach to, because initially what happens is that people, when they start delivering the session, they don't have the rapport, they find it more difficult, the mothers were not trusting them, their families were not trusting them. But as they start giving more and more sessions, they become more confident, mother starts trusting them, so it becomes, so maybe rather than asking a general question or asking about through all of their experience, I think it's better if you break it. Okay. What encouraged, motivated you to deliver the session? Good question. Challenges, what challenges did you face when delivering the session? Yes. Good. Thank you. So Muhammadan Nabi has asked that what do you think you should do when you see such symptoms within yourself or your relatives? So
Sorry, Dr.
Nabi,
Najia, you need to, hello, we need to start from the beginning, it's the last end. So I have put another one. And if you go up,
oh, sorry. Where is the other one?
yeah, just above the one you were reading.
Oh, maybe that one
So
hasn't. I didn't. I only received this one. Can you see my screen? I have only received this one.
I put two messages. Have you got the first one?
So
That
above
starts
that,
with
there is
topic
a
guide for
message.
KII.
Above that, there is a message from Seham. Dear fellows, please raise hands once back and your message.
All right. Okay. I think then there's the internet issue. So I'll just post it now.
Okay.
Just
So
bear
what
with me.
the comments about these two questions are, Nabi. Again, you are asking two things in one question, that what do they do and what do they think? And then I think the word should, these are very strong words. So I think we should not be using the should words that much. If we could replace it with what do they think is necessary, if somebody who is experiencing these symptoms. So first of all, breaking question one into two parts. What do people do when they see someone who has symptoms of depression? And what do people think when they see someone with someone who has depression? And again, if they experience such symptoms, what do they think, or and then if they are experiencing these symptoms, what do they do? So basically there are four questions in your one question. Nabi, are you with me?
Yeah. I am. I'm following you. Yeah.
So the important message is to ask one thing in one question.
Okay, I got you. Yeah.
Okay. So you have asked 4 things in one question. Your question number 2, whom do you go? You think you should go for treatment of some such symptoms. So, so you can ask that what do people do for the treatment of depression, or what do people do when they experience such symptoms?
Yeah.
And here, if you are asking that what do you do if you have these symptoms, you are making an assumption that they are depressed.
Yeah, I mean, it's a follow-up question.
Oh, follow
At
up.
the
Yes, yes.
beginning,
Okay.
there's a question like if they have
Okay. So
experienced
have you
depression
posted?
before.
Okay. So if you will post the follow up, oh yes. Okay, yes, yes. Now we got the full thing. How important do you think mental health is for women during pregnancy or after childbirth? Okay. Again, you can divide it into 2 halves. Importance of mental health for women during pregnancy, and then again, when they have given you the answer, importance of mental health after childbirth. Have you heard, experienced that sometimes during pregnancy or immediately after childbirth, women may have persistent feeling of sadness and low mood, citing more symptoms? Have you heard? This is a close-ended question because they will say yes or no. So we have to pose our questions so that they are open-ended. So do you think if such feelings continue, it may affect the health of mother and also baby? So again, this is similar to question number 1. Why do you think mental health, how important? Okay, okay. So sorry, this is different. Okay. Again, 2 parts.
I'm trying to break it down into 3 areas. Like I want to understand their knowledge, what they know, and then their attitudes and their practices.
Excellent.
So I put the questions into 3 segments. So first, like their current knowledge about perinatal depression or the importance of maternal mental health, and then like what they do when they see such symptoms. So their practices.
Sometimes it also helps if you give your topic guides headings. So maybe in your topic guide, the first set of questions has the heading of understanding the people's understanding of mental health. And then you ask some questions. Then the second set of questions again has a heading, what you have just mentioned. And then the third set of questions have the heading of what are their attitudes. So you know that exactly what sort of a questions you are asking them. Do you think if such feelings continue, it may affect the health of mother and also the baby? Again, Nabi, you have to separate the mother and the baby part. Do you think if such feelings continue, it may affect the health of mother? If I will say no, then you will not ask me the why question.
Yeah.
Again, whenever we ask these did questions, they are not good because they are not open-ended.
No, I was thinking of rephrasing these questions to make it open-ended. But I thought, like, if I give them a clue, they may start sharing more experiences. So I'm not sure like how to make it like open-ended questions.
But this is what you want. You want them to be sharing more experiences.
Yeah.
Did your husband, family members provide mental health during pregnancy? And again, then you write if yes, how, so that is more acceptable. So if they have said yes, they provide mental health support, then you ask them how they have provided mental health support. But it's, I think with regards to your topic guides, it's very important if you break them into different subgroups, and specify which questions you are going to ask with regards to their attitudes, with regards to the treatment they are getting, with regards to separating them is important. Good. Any comment with regards to any questions everyone has shared?
Dr. Nazia, so just like, wanted to know from you. So what we have been doing is like we start off with a broader question, and sometimes it does waver to different directions, and we use that probe to bring the conversation back to line. Like, yeah, usually we start with the broader questions, and sometimes it helps and sometimes it doesn't. So, like, what are some of the things that you would like to suggest?
I think like when I shared this screen with you, Prasansa, I think this is the model which we needs to be keeping in our mind. So if we are asking too broad a question, the interview can go in any direction. And it is also all right, but then you have to be really thinking, these are the points which have been covered. So if they have already been covered, I'm not going to ask them again. You give that open stage to the participants, and the participants, they then can tell you whatever they want. And there is nothing wrong with it because this is in-depth interviews. But if you want to contain more things, then you start with something specific. And sometimes when you ask too broad a question, that can also confuse the participant, that what can I tell, which sort of an experience they want to know. Do they want to know my experience of starting from home and all the problems which I experience in transportation? Do they want to know my experience when I'm actually in their homes? So let's make their life easier and let's make our life easier as well. Okay. Good. Okay. So we are done with this activity, and I hope this activity is actually hopefully will help you when you will be developing your topic guide. Never ask two questions in one question. This is a very common mistake. Be just pose your question so that you can get maximum information. So that's key rules. So data collection are techniques and strategies that are used to collect or generate data. It could be done through observations. Suman has gone into a big detail yesterday. It could be interviews. It could be focus group discussions. It could be written material such as letters. It could be documentaries. It could be photographs. So these are all different ways of collecting the data. So here is this slide just tells you that suppose if you decide to use phenomenological approach, I'll never use it in my entire life if I can't say the word. So the in-depth interviews are suitable for phenomenological approach. They are suitable for grounded theory. They are suitable for narrative. In-depth interviews are suitable for everything. If you are using focus group discussion, then like Nabi wanted to use for his grounded theory, he wanted to do focus group discussions. Then in ethnography, sometimes you make all the participants sit and you do the discussions. Framework analysis, focus group discussions are suitable. Observations in phenomenological approach, you don't do observations. Grounded theory, it's very rare. Narrative, it's suitable. Ethnography, very, very suitable. Framework analysis approach, it's suitable. So Nabi, if I ask you why you have decided that you are going to do focus group discussions rather than interviews? Hello, Nabi.
Actually, I have two objectives. For the second one, am I audible? I'm really sorry. I'm having some
No, we can hear
internet
you
today.
We can't see you.
Hello, I'm audible.
Yes.
Yeah, I mean, I just switch off my camera is because I'm having problem with the internet speed. So, all right. I mean, I have actually two objectives in my research. So the first one will be to understand, as I mentioned before, to understand the perception of depression among the slum people. And the second one, first one, I'm going to use in-depth interview. And for the second one, which is our facilities or requirements that are needed to deliver a psychological intervention through mobile phone platform. So for the second one, I'm planning to have focus group discussions. In that group, like I'll see both the service recipients, the young, potential mothers, the new mothers, the pregnant women, and also like the family supports like husbands, the mothers-in-law, and also the delivery agents. So to see their perception about psychological intervention and the possibility of delivering it through mobile phones.
Okay. So that's good as long as you can justify it. One advice which my supervisor gave to me, actually, I have a lot of respect for her. Her name is Dr. Karina Lovell, Professor Karina Lovell. So one advice she gave to me is never dig holes for yourself. So try to keep things as simple, straightforward. You know exactly what you are doing. And if even during the Viva, if you don't know anything, just simply say, because otherwise, if you are digging holes for yourself, it will become very difficult. So anyway, my research question, how best to integrate thinking healthy program intervention into Krisansa, yes, sorry, I didn't see your hand raised. Krishani, sorry.
Dr. Nadia, this is regarding the previous slide. Can you go to that? I'm asking, this is out of confusion. So yesterday we learned ethnography, and there Suman mentioned that we are using this grounded theory. So here it is another approach similar to phenomenology and other. So can you just give me an idea? I'm just feel a bit confused here. Yeah.
Okay. So Krishani, yesterday Suman, he told us about ethnography, which is a different approach from grounded theory. So maybe when you are doing these grounded theory, you are doing some observations, but that is not ethnography. In ethnography, you are mainly doing the observations. So what you are primarily doing, if you are doing the observations, then it is ethnography. And if you are collecting the data through interviews, through focus group discussions, then this is, and using the methods which grounded theory propose, then you are doing the grounded theory. They are different approaches.
Okay, thank you. Yeah.
Okay, so that was my research question. My research approach, which I decided to use, was framework analysis approach. The sampling method, which I decided to use, was purposive sampling, and the data I collected through the interviews and through the focus group discussions. So when I am interested in knowing the views of the mothers, I did interviews, because that helped me to gain a deeper understanding, while I could ensure them the confidentiality of the information disclosed. And when I decided to conduct focus group discussions with the lady health worker, I would like to explore the issues from different dimensions. So for example, like Suman wanted to do some focus group discussions because he wants to know the attitude of the people. They are good because sometimes when people are discussing it, that really helps to get more information about what people think about mental health. If they are talking personally about their own mental health, sometimes they could feel a bit shy. If I'm doing a focus group discussion, then that is best if I conduct a in-depth interview, one-to-one. So again, your justification would be very important. So interviews are simply defined as conversation with a purpose, as simple as that. And this is the most common qualitative data collection method. They can help to understand the participant's point of view by talking to them. And there are two types of interviews, one-to-one and couple interviews. So if there are only two people, that is not focus group discussion, that could be couples interview. So in-depth interviews, it's people think that they can just sit with the topic guide and they can read those questions and they can get the answers. That is not the case, unfortunately. You need to have a very good understanding. And that's why, like, I can never present anything if I have not developed that presentation. So when you develop your presentation, you know exactly what is there, you know what other information you need to be giving. If I'm using someone else's presentation, personally, I can't do it. Likewise, if I have developed the topic guide myself, I will know everything ins and outs. And also, the most important thing is I am listening actively to them and I have a good memory. You know, good memory is very important. Like when we say if somebody has already given the information, there is no point of asking it again because you know that they have already given it. You have to think on your feet because sometimes what happens is that the way you have written the question, the other person cannot understand it for any reason. So you need to be thinking of rephrasing the question, asking them in a different way. You need to have a good observational skills. So maybe if you feel that the mother is getting tired, maybe you give her some break, ask her to go and have a glass of water. If the mother is feeling anxious, maybe you think of slightly rephrasing your question. You need to be empathetic. And this is Pragya, when we were discussing about how much counseling skills we can be using. Being empathetic is very important because if you are not being empathetic, she's not going to telling you her experiences. You can't be judgmental. You can't be saying, no, you are not right, or this is not what happens. And then that is going to stop her. You need to be knowledgeable on that topic as well. So for example, if a mother is saying, I'm giving you a very basic example, that if a mother is saying that, yes, I had a cesarean and you don't know what cesarean is, and you ask the mother, actually what cesarean is? So that the mother is not there to be teaching you. She's there to be telling you her experiences. So some basic knowledge is very important. And your communication and conversational skills are very important. You should be asking questions in a clear manner so that the other person, the only time when I feel that the people, when they are asking the question because they have confusion in their mind, so when they pose the question, it becomes difficult to understand it. And but other time it can also be the listener's problem that maybe they are not understanding it. But the more clear you are in your mind, the more clear questions you are going to put. So have we all got these qualities? Yes. Okay, so this is something which we have talked about yesterday and day before yesterday, that how important it is to be aware of your own preconceptions, prejudices. Sorry, Nabi, I can see your hand raised. Hello, Nabi.
Yeah, I'm just, hello.
Yes, Nabi.
All right, Sam. Can you hear me?
Yes, we can.
Yeah, for my PhD research, do I have to take all the interviews myself, or can I take help from someone else? Like, to interview a pregnant woman, help from a lady or a kind of, female research assistant. Is it acceptable, or I have to do it myself?
Yes. Ideally, you should be doing it yourself. But if this is a situation where you are going to interview pregnant women and they are not happy, or you think that they will not open up that much, then you can ask the assistance of someone else. If the women don't mind, you can be there in the interview and the other person is asking all the questions. But if they don't even, if you feel that your presence is going to restrict their responses, then it's better if you are not there. So again, if these are the interviews which you have not conducted yourself, you need justification. that most probably these women would not have shared their experiences freely. So that's why you have asked the other person who is trained in conducting focus group discussions to go and conduct it on your behalf. But suppose if in your PhD study, you have asked all the interviews, all the focus group discussions to be conducted by someone else, then I think that is not a good practice. But in some cases, yes, you can do where necessary. Is that clear, Nabi?
Yeah, thank you so much.
Nabi, it's not fair. The last 2 days, your internet was okay. And the day when I am delivering my training, your internet is not good.
I'm not sure, like, the
Tomorrow.
internet is like, being.
Okay. So tomorrow, Nabi, I want your internet to be good. Otherwise, I will not
I'm
be.
signing out. Okay, I'll contact with my internet service provider.
Thank you. Thank you. Okay. So this is something which we have discussed yesterday, that we need to be aware of our gender, age, relationship. And this is linked to the Nabi's point as well, because he felt that maybe him being a male person will not be able to generate rich information from pregnant women. But sometimes these are our preconceptions as well. So maybe, Nabi, you don't know for sure. Maybe you will go and they are quite open. So again, maybe this is something which you can test and then decide.
Yeah, I'll try my luck. Sure.
Because, sometimes here, when I'm doing my therapy work, sometimes people feel that maybe other Asian women will feel more comfortable if there is an Asian therapist, but sometimes they don't. Sometimes they feel more comfortable if there is an English therapist, because they can tell whatever is there. They don't fear that they are being judged. And sometimes they do fear that if it's an Asian therapist, she might judge her. So these are all preconceptions. We need to question them. So it's best if you first try, and if you will not succeed, then by all means ask someone else. Social desirability factor is always going to be there, and you can try your best, you can reassure them, but then that is there. But it is becoming lesser in newer generation, which I have felt, because they are more open and honest with their responses, whereas people of my sort of a generation, they are more worried about whether they have given the right answer or not. Prasansa, am I right? So let's talk about some advantages and disadvantages of in-depth interview. The greatest advantage is that it captures in depth the views of the participants, and you can discuss private matters, explores concepts which are very specific to the participant, because when you are in a focus group, you are asking general sort of a question. So Nabi, in your case, you can be asking questions about what do people think when they see somebody with the symptoms of depression. But if you are more specific question, then what do you think? So maybe that person is thinking that, oh, I think that person is crazy if he's having a symptoms of, but he will feel reluctant to give his true response when there are other participants sitting in there in the group. So therefore, it is very important to think clearly that whether you want in-depth interviews or focus group discussions. And interviews, most people are familiar with. The disadvantage is that they are heavy on resources, they are time consuming, and they are reliant on interviewer skill. And there could be power issues. So for example, if I decide to interview one of my trainees, that's not going to be a good interview, because the social desirability factor may be at its peak, and they will give me responses which they feel I will be happy to hear. Okay, now this is the point where this Nida room break thing will come. I don't know how that's going to work. But so Prasansa and Pragya, you are sort of working together. So it's best if one of you can work with Nabi. So let's say, Prasansa, if you can walk with Nabi and Pragya can walk with Krishani. Will that be okay? So Nida, how you are going to break this this room thing? I don't know.
Yeah, I'm just trying to. So Pragya with.
Pragya will work with Nabi and Prasansa will work with Krishani, unless they have some objection and they can let me know.
So Pragya and Nabi in the room 1. Please note your room numbers. Okay, next Prasansa with Krishani.
So Nida, what will happen to you and me? Where will we remain?
We will be in the 3rd room.
3rd room. Okay.
Yes.
So please, okay. So this will just be few questions which you will be asking. Oh, Nida, please stop 1 minute. Nida, 1 minute. Hi.
I can't stop now.
So please read the what is says on the activity. You have to record it. Nida, how we can tell the other group that they have to record it? Krishani is still here. She has not gone in the other room.
Krishani was Prasansa, no? With Prasansa?
Yes.
Yes.
So only Prasansa has gone in the other room.
No, Krishani, you must have received the notification and you need to join.
Yeah.
Yes.
Yes, because
So
Dr.
Krishani,
Nadia is
please-
talking, I will wait.
So, okay, stay here for a while.
So you have to record it. So I don't know how you can record it.
Okay.
Nida, how they can record it?
And
And how we'll tell the other group that they have to record it? Who will go in their room?
Dr. Nadia, I am actually very clueless. Is the Dr. Saham available here?
Okay, Krishani, you go and start your interview. Bye, Krishani. निदा हम उनको कैसे बताएं? Maybe they have already read it. So Nida, if I stop and join, then you and me will be in room number 3.
Yes.
Krishani,
You may
are
please
you
join.
there? No, but we don't need to. We don't need
Okay,
to.
okay.
Krishani, are you here or not? We can see Krishani. Oh, चली गई.
No, she went.
अब मसला ये है कि अब उनको कैसे बताएंगे रिकॉर्ड करना?
मुझे लगता है कि रिकॉर्ड तो हो रहा है ऑटोमेटिकली, लेकिन कैसे पता चलेगा?
अलग रूम्स में रिकॉर्ड हो रहा है. अब हमारी आवाज रिकॉर्ड हो रही होगी ना.
मैं इधर आ गया ब्रॉडकास्ट मैसेज टू ऑल. सो व्हाट शुड आई राइट?
I am writing it. Please record your interview.
Okay.
Either you know how they will come back.
Because I will close all the rooms.
Okay. Chalo, after 5 minutes, okay?
Okay.
I am going for water.
Dr. Nazia or Nida?
Yes, Prasad sir.
So we are trying to record the session, but then it is asking the host permission to record.
So Prasansa, what you can do is that you can record on your mobile.
Like this?
Yes.
Yes.
Okay.
So
All
yes,
right.
thank you. Please ask
Okay.
permission from your interviewee. Bye.
Sure. All right. Okay.
Ji Nida, I see you haven't joined in.
Dr. Sam, we are here. I wasn't in any of the room.
Okay, that's fine. And I hope the joining rooms ठीक ही चल रहे हैं.
बस हमें ये नहीं समझ आया कि क्या उन लोगों की रिकॉर्डिंग हो रही होगी क्योंकि अभी तो
मुझे ऐसे लगता है कि जूम कॉल के मेन ही रिकॉर्ड हो रहा होता है. ब्रेकआउट रूम्स के अंदर चीज शायद प्रॉपर्ली रिकॉर्ड नहीं हो रही थी.
probably.
Unless you want to join one group and see के वहाँ पे recording का अलग सेशन फिर वो होस्ट ही सिर्फ रिकॉर्ड कर सकता है. Otherwise तो नहीं. तो ठीक है. I think as long as के वापस जब आते हैं ब्रेकआउट से रूम से तो बाकी तो कंटेंट ने तो मेन सेशन में डिस्कस होना है. That's what is important. So worries, no worries. That's fine. That is fine.
से हम उनके लिए हम चाहते थे रिकॉर्डिंग हो जाए क्योंकि फिर उनको होमवर्क है कि उन्होंने ट्रांसक्राइब करना.
This we should have worked out earlier on, Najia. I don't know if this will be possible.
प्रशंसा ने पूछा था तो उसमें मैंने कहा मोबाइल पे रिकॉर्ड कर लो, लेकिन ये गलती हुई है. चलो कोई बात नहीं.
Yeah, so let's see how much we can can make out of it. I'm not sure if they can record. What we can do is I can join one of the rooms and see if this can be recorded. Yeah. So I'll.
Yes, this could be a possibility.
अब तो वो काफी कर भी चुके होंगे, फिर रहने देते हैं.
Sure, if they there are other ways to take notes and expand them, like you do in field notes. Use them rather than audio recording and transcribing. So whatever that comes to their sort of memory, both the people who were being interviewed and the one who was being conducting the interview, they can both team up as an assignment, draw up whatever things were discussed as field notes or expanded or fair notes. That's also another way to help collate. Yeah. So let me, but let me join one of the groups and see.
दोनों कमरों में जाना से हम.
Will do. Will do.
चलो निधा, अच्छी जा रही है ट्रेनिंग?
Yes, ma'am, perfectly going.
बड़ा चेहरा अब कराया है, वैसे सारा टाइम ही कराया. ये रिकॉर्डिंग
मैंने चेहरा कराकर क्या करना था?
रिकॉर्डिंग चलती रहती.
और हमारी रिकॉर्डिंग वो सुन लेंगे बाद में.
कितना अच्छा रिकॉर्डिंग. So Nida, exactly at 11:39, please ask them to come back to the main training.
Okay.
Thank you. Yes, Sam.
Yes, I've enabled their recording. Yeah, I've enabled their recording. You need to go into the breakout room and give them the. So I'm doing the same for Nabi and Pragya. See you in a bit.
But they are about to finish now, so.
मैम लेट मी टेक द स्नैप एंड स्टे. आप अपना कैमरा ओपन रखिए, इससे मुझे पता चलेगा मैं भी मीटिंग में थी. मैं दूसरों की तो ले रही हूँ. काफी लिया आप लोगों की.
Good. Nida, could you now ask everyone to come back?
Sure.
They're nearly done, and they will all be back in a bit.
Okay, thank you, Seha. So this is the first time I'm using this separate rooms. I don't know. I think that has worked well.
Yes, I think this is a good Zoom. I think Teams also has this option. But I was more familiar with Zoom because we use this in the university's department as well at Liverpool. So I'm quite familiar with these breakout rooms and etc. Yeah.
But there must be one option like आपके main screen पे सारे rooms नजर आ रहे हो कि people what people are doing.
Yes.
I think I think that needs a little bit of more exploration. So I see that Nabi and Pragya are back. And Najia, will we need the breakout rooms?
No,
further?
not for tomorrow. No.
Not for tomorrow. Okay, right.
Actually, we only did one role from Nabi, but we have not switched our role.
Okay.
After the message from Nida, we immediately came back in the main room.
Okay, sorry. So you didn't get chance to do the interview other way. So did Nabi did yours or did you have done for Nabi? Who was the interviewer?
Nabi was interviewer. So I think it is totally fine if we have time, then we can go back and switch the role. Otherwise, it's totally fine. If we don't have time, then that's fine.
I think I don't know how long the other people are going. The other pair is going to take.
I think they were halfway done when I enabled their recording, so they should be back in a couple of minutes or so.
So Pragya, after this bit will finish, would it be possible for you just to stay behind for 10 minutes and you can ask those questions to, I hope Nida, you don't mind, and then Nida will respond to your questions. Would that be all right? If you have just 10 minutes after the training, Nida, will you be able to do that? Nida?
Yes, Dr. Najia, I will.
Thank you very much.
Do we want to check with Krishani and Prasansa how long they are going to be?
Yes, please. Can you go in their room and ask them?
I'll go. Yeah. Let me do that. They're coming back in about 30 seconds.
So we will start by asking Nabi, how was your experience of asking the questions? Hello?
Can you hear me?
Yes, we can. Yes.
It was good, but as you said, in my questions I put two things together. Say I mentioned, like, if you have, do you feel any kind of low mood during your pregnancy or after childbirth? But Pragya responded like she felt bad, sad during pregnancy, and not during pregnancy, after the childbirth. So as you pointed out before, that I need to put two questions for two different answers. So I mean, it was like a pilot testing. So I think I need to think over the questions and rephrase and reframe. Yeah. So thank you.
Okay. So rather than asking, Nabi, another thing, rather than asking that, do you feel depressed when you were pregnant? That is like a suggestive sort of a question. So we should rather be asking that, how do you feel when you were pregnant? So that will then let the other person decide and tell you how they were feeling. So we should not be asking suggestive questions.
Okay.
Thank you. So Pragya, your hand is raised, and I would also like to know, how was your experience of responding to Navi's question?
Some of the question that I realized that is a learning for me as well. Like here in Nepal, we when someone asks like about mental health, then that is very broad, and we don't really understand what does that mean. So it was really nice when Nabi rephrased it again, like he was joining with physical health and then mental health. And when I asked what mental health does that mean, so and he tried to elaborate the question, and that really I really like that, and it was a learning for me as well.
Excellent. Thank you very much, Pragya. And so, how was Krishania, your experience of asking the questions? Krishani?
So when I'm asking questions, I felt it was at the beginning. So we joined the breakout rooms late. Then I thought we will not have much time. So I rushed. Anyway, so I didn't take the I didn't introduce myself and then go to the very warm up kind of questions. So then I think it make me a bit difficult to ask the questions, but anyway, then I continued, and again, because I didn't introduce, then Prasansa feel it bit difficult to answer, I think, because she thought I'm asking her as a delivery agent, but I want to ask she to be pregnant mother. That was there. Anyway, it went good. Yeah, and when Prasansa asked me questions, I felt ease because she started from the introduction, and then we went there from there.
Okay, thank you very much, Krishani, for this feedback. Prasansa, would you like to share your experience of asking the questions and as an interviewee?
Yes, as an interview, Krishani has already mentioned, like, I thought my role was different, but then when she asked me second question, and then I could tell, oh, my role should be different. So yeah, I think the introduction and, like, informal, what do you say, chit chat in the earlier might set up a background. So that's what I learned from her and immediately applied in when I was uh, playing the role of an interviewer. And when I used my qualitative guide that questions that I had initially shared, what I came to realization was the first question, how was your experience delivering, the THP was like, it overlapped with the second question. So she started talking about the motivating factors, like what facilitate her to, like, to work as a volunteer. So I thought, like, it was not necessary to ask the second question about the facilitators. So I totally skipped that and only focused on the challenges later on.
Mm-hmm. So like we discussed, Prasansa, that sometimes it's not very good idea to asking such a broad question right from the beginning. So let's start from the specific and then ask when we are doing this focused questions. So, and again, this has also made you realize the importance of pilot testing, because the pilot testing really helps to finalize your topic guide, to change the wordings of the questions, to ask if there are any questions which are asking the similar sort of information. So it's very, very important that we do the pilot testing. And if there are a lot of changes you have made as a result of your pilot testing, you pilot test it again until you are very happy that, yes, this is the right topic guide. I'm getting all the information which I needed and there are no questions which is confusing anyone. Good. So now we move, sorry, yes, Sehan?
Just to add, since they've had a go at, so it's more pilot, understanding that not to pose double barrel questions, that's another learning that you're experiencing. So you ask somebody two questions in the same sort of statement. One thing that I will just try and add and reiterate, perhaps it was said, and Najia did mention it earlier, or probably Shmoon did. These topic guides, like in the quantitative studies, the topic guide is your questionnaire. Either it's a fixed response, PHQ-9, Likert scale, or it's some measure, or it's a blood pressure apparatus or a height stand, etc. Right? But in the qualitative, the topic guide is just a guide. The instrument is you yourself. That's a very stark distinction. It's upon you how you navigate those questions. As long as you have the game plan, you can start broader, you can keep posing probes, keep the person on the topic. So now the instrument is you actually. So please bear that in mind, and it comes with practice. So as you progress, you'll understand what this actually means, and hopefully this will resonate sooner than later. So over to you, Najia. Just wanted to add that.
No, thank you very much, Seham. So now we will move on to the focus group discussions. They are designed to answer specific research questions. They are led by moderators with a designated note taker. So whenever you are conducting the focus group discussion, you need somebody to be taking notes. As Nabi, I can see your hand raised.
Yeah, I'm just wondering, in Islam, there's a term called time poverty. It's because, the women, they are all engaged with some informal works and generate income. So it's sometimes not very possible to take an interview for a longer period of time. They're busy with different activities. So is it okay if, if someone says, I can't give you more time at the moment, please come back later. So is it fine if I do the same interview on two separate occasions?
If you are really struggling, then that is all right. But then next time, there should not be a very huge gap. So it should not be week before those two part of interviews. If you decide to go next day, then it will be really good so that they remember what they have already said, and then you start from where you have left. But if that is the only option, then that is all right.
All right, thank you.
So the data collection instrument is the moderator, like Seham was mentioning, that it is not the topic guide, but it's you as a main person who will be collecting all the data. So to guide the discussion from the role of a moderator is that they have to guide the discussion from opening question to conclusion. They seek details and informative answers from participants. They ensure that they are getting a whole wide range of perspectives. And this they can assure through involving all the participants who are sitting there. They make sure that all views are represented in the data, and they create a non-judgmental and welcoming environment. This is very, very important. You want to make sure that all the participants are at ease. You can do a bit of an icebreaker before you start the focus group to make the participants feel more at home. Yes, Pragya?
Just a curiosity that how long can be in-depth interview or FTD?
The in-depth interview can usually be around 45 to 60 minutes. And the focus group discussions are usually between 1.5 hours to 2 hours. But again, this is not a hard and fast rule, that is just the estimate. So again, when you are asking for ethical approval, you also need to tell them that how long you think the in-depth interview is going to last. And when you are pilot testing, sorry, you also get the idea that how long it's going to take. So if your in-depth interview is going to take 2 hours, then it means that you need to rethink of your topic guide, or you decide that you are going to do the interviews in 2 parts if it is too long, because we don't want to stress and tire the other person. Can you see this picture here at the bottom of the screen? So usually when you do the focus group discussion, you draw this sort of a picture so that you know exactly where the participants are sitting. And when you transcribe them, you also write that participant 1 says that, participant 2 says that, participant 3 says that. So that when you are analyzing it, you have got a good idea. And the note taker sits at the back, and they are only aimed to take the notes. And the moderator is the one who is doing all the facilitation. So the role of the note taker is to take notes and to document any non-verbal clues to capture degree of consensus. So for example, if there is one thing which has been said by participant 1, but no one else agrees to it, then they need to make a note of it. And suppose if participant 2 has said to it, then participant 5 and participant 6 have agreed, but participant 1 and participant 4 have disagreed. So the note taker's role is also very, very important. They need to make sure that they are taking all these notes. And also to time keep during discussions, because sometimes you tend to forget the time when you are into very much heated discussions. So again, like everything else in the world, there are some advantages and disadvantages. The advantages of focus group is, sorry, Nabi, yes?
As a PhD researcher, what would be more suitable role, as a note taker or as the moderator? When you do note taking, you can, concentrate more on the speeches and the non-verbal cues. So what should be my role as a PhD researcher?
Your role should be moderator. And there should be someone who is experienced in a note taker, can become a note taker. But as a moderator, you can ask more questions. You make sure that everybody is involved. So I think your role needs to be a moderator. So the advantages of group discussion, focus group discussion, is that it can help people to explore and clarify their views. Sometimes we get a very rich information when people, they are talking to each other, they are discussing on something, and maybe during that process, their thinking changes. It encourages the participants to participate who are reluctant to give interviews on their own. It can facilitate the discussion of taboo topics, but it has its disadvantages as well. So some people, they are shy to speak in groups. Some people, they tend to agree if they have got an opinion which is different from everybody else. They try not to disclose it in a group. Some people, they may dominate the group, and that inevitably happens that there are 1 or 2 members of the group and they are the one who is talking the most. So there are techniques how you can involve the other members of the group. For example, make less eye contact with those who are talking all the time. Asking other people by name if they want to say something, or just say that I have heard your opinion. Thank you very much. Now let's see what other people are going to say. So there are different ways how you make sure that everybody is engaged. There could be power issues as well. So if, for example, within the group, if there are other members who are in senior position to you, then you tend to stay quiet, especially when you're not agreeing to them. Confidentiality can be a problem. So you must, if you have disclosed something, you can't guarantee the confidentiality of from every other participant. So this has happened once in our focus group, where somebody was saying something, and the other person who was sitting was actually friends with the mother-in-law. So she went and told the mother-in-law what the daughter-in-law was saying in the group. So it is very important to be setting the ground rules as well. And whenever you are doing the focus group, please tell the group that they should only be disclosing things which they are comfortable with in front of everybody else, because you can't guarantee the confidentiality from them. Of course, you are not going to say something, but you can't guarantee it for everybody else. Traveling to the location could be a problem because in the focus group, there is one venue and people have to come to that venue. Okay. So any questions so far? We are almost coming towards the end, so maybe another 10 minutes. But I'm sure that, yes, Prasansa?
Sometimes the note taker, like there are instances where we have conceptualized the study. It's not just one person, but the other person is also engaged in the focused group discussion. And sometimes if I'm the moderator, but I tend to pick up some nuances. So my note taker friend has also helped me, to ask some of the questions that I've missed out. So is it acceptable, theory-wise, for the note taker to come in and?
There is no harm in it. You can ask your note taker that, is there anything you would like to ask? And that it will be a clue for the note taker that you have missed this thing and they can ask. Or you can ask the note taker that, do you want to remind me if I've missed anything? So that is all right. Just remember, our main purpose is to collect a rich data. So if we need some sort of a facilitation, the only thing that why we are keeping these roles separate is because if note taker will be involved in the discussion as well, that can take some of his or her focus away from making the notes. And they have to be very observant. They need to be keeping an eye on all the participants and how they have been feeling and how they have been behaving. So for example, if one of the participants is feeling sleepy, then maybe in the notes they can say the participant too was disinterested and things like that.
And may I just quickly add to what Prasansa is saying? I find one of the things that I do and I've done many a times very useful as the moderator. With every section or with every question or with every probe that you've exhausted on your topic guide, take a pause, ask the participants if there is anything else that they would like to add, which I may have missed, which they might think that came in their mind, but in my flow of discussion got lost. So give them the time. You'll be surprised. Certain very important things come up because when you're hearing, there are things that are happening in your mind. There are things that are coming to your mind, but since they're following the moderator's lead, at times certain things get missed.
I think that's a very, very important point to add to this. Thank you very much, Sehan. So you have done your data collection as well. Now come the point of transcribing the data. So transcribing means that you are writing, it is the written record of the interview or a focus group. And before you transcribe it, it is very important that you just add some details to your transcription. For example, the name of your research project, speaker who you are interviewing. It's best not to use their real name. So when you are transcribing, you give them either a pseudo name or just ID number. So never in the transcriptions we use the correct name. The date and time of the interview, context and setting where that interview was conducted, audio file name or number if there is one available, duration of interview, how long was it. Then transcription, when you are transcribing the data, it allows you to understand it intimately and you become immersed in it. So when you're analyzing your data, the first step is the familiarization. So when you are transcribing the data, you are becoming more and more familiar with it. And that really helps when you are analyzing it. Because if you have conducted the interviews, you know exactly the tone by which the interviewee has said something. And again, this is something, Nabi, when you were asking that question, because if you have conducted the interview, you know exactly from where the interviewee was coming. What was his tone? Because in the transcription, you can't tell the tone of the person. Sometimes in the brackets, you do write that the participant starts crying or participant starts feeling angry, participant was avoiding, participant was not making eye contact. But this is possible only when you have done the interview and you are transcribing it. But transcribing is not easy. Sorry, Sam, did you raise your hand? No, sorry. But transcribing is not easy. It is a very, very tedious job. And most of the people feel that it's best if they leave it to someone else. Now, I can't comment on that because I have done that for my PhD study as well. But it is best if you transcribe it yourself. But it does take a lot of time and depending on your other work commitments. However, you cannot undermine the value of this step. That can really help you to formulate your finding and writing your research report. You can just imagine it, all the time and energy you are putting into it. So as a homework, remember the interviews which you have done in your separate rooms. I don't want you to transcribing all of them, just the first 5 minutes. And most probably the first 5 minutes is going to take an hour. Nida, how long do you think the first 5 minutes can take?
First, sorry, I didn't get your point.
So how long does it take to transcribe the 5 minutes of an interview?
It will take hardly 10 to 15 minutes.
Oh, that's not bad then. Fine. Thank you, Nida. So, so I would like you to get that 5 minutes chunk, the best chunk from your interview and transcribe it. Please do this homework. I'll strongly request you because we will be using your transcriptions to do some analysis. If you want to do more than 5 minutes, it's up to you, but this is the least I would request you to do. So before we finish today's training, Pragya, you have to do interview with Nida afterwards. Do you remember? Thank you very much. Thank you, Nida. We are end of today's session. Is there any question or feedback or comment you would like to give? Yes, Prasant sir.
So Dr. Nazia, one of the things that I have been struggling with is transcribing focus group discussions with the P1, P2, P3, P4. Like sometimes I just get lost track. I just lost track of who is P1, who is P2. So like how do we, is there any strategy to mitigate that? And especially when the transcriber is someone who was not present during the FGD, like how can that be done?
Oh, Prasant sir, sorry, I don't know the answer to this question, but I'm thinking maybe if the note taker can help. Oh, sorry, I don't know. So maybe the note taker can help. How can the note taker help? Has anybody got any suggestion?
Ajay, there are a couple of ways to address this, especially when the transcriber is not the person who either was moderating or was taking the notes and is listening to the audio recording. Yeah. So to address that, one of the strategies is that people refer to their, there's a ground rule that since it's been recording's been done. So either the moderator herself or himself says that Seham now is going to speak. So you get the recorded name of the participant. Yeah?
Yes, that's a very, very good idea. So you mentioned, yes. Yeah, thank you,
It
Seham.
just it takes a little bit of a run in time for people to, and if somebody misses and jumps to say, so you just politely with near the recorder that Seham started speaking and was providing the views at the end. Yeah, so that the transcriber knows how to navigate who's saying who and what is being said. That's one of the strategies that usually done.
Very clever. Thank you, Seham. So you yourself record, Seham has said that. Anybody else want to say is that? Thank you for your views, Prasansa. Now let's see what Pragya has to say. So another thing which I need to tell is in that table, can you see 2 tape recorders? That's also very important. That's like a backup thing, and also to capture the voices better. So if one battery has run out or anything has happened, then instead of all your efforts going to waste, you have another backup. Thank you, Prasansa. That was a very clever question, and thank you, Seham, for responding to it. Any other question? Yes, Nabi.
When you do the transcription, do you have to do, I mean, we are having the audio recording, so the primary source of data will be there for verification or authentication. So do you have to transcribe and translate the whole thing again? Or can I just find the theme and start, coding from there, from the audio recording? Or do you have to do the transcription, translation, all before going to identify the theme and do the coding?
So Nabi, again, this is something which we will discuss tomorrow. So I will tell you how I do it. I don't translate all the transcriptions. I analyze it in the first language, and then whatever themes and sub-themes have come up, that I translate, and any codes which I am using to support them, I translate them. But I'll show you the tables which I have made. Yes, Seham?
Just to build on my last suggestion, I just realized that when you get people's names recorded as part of the consenting procedure, you need to tell them that this recording, where your name is associated with any of the comments that you make, will be redacted, will be removed. This is just to link who's saying what, who's disagreeing, who's not, because we need to analyze. So please be rest assured that these names will not come, that Seham was, associated by saying this. So you need to ensure that that sort of dynamic.
Or Seham, even at that stage, they can say that participant 1 has said that. So let's see what participant 2 is going to say.
And then you just, exactly, as long as there is some way for your transcriber and eventually you yourself, who's going to code and index all the findings. About 6 people disagreed totally. There was dissent between 2, 4, etc. So a way to just navigate. So that's that's something important that just came to my mind. Sorry. So Pragya, you raised your hand.
Yeah, I was just imagining that like when there is U circle, semicircle, then putting the tab P1 with name, and but not asking and not repeating the name, but P1 has said this for the moderator and for also the note taker, maybe. Just the rough idea.
Yes. Yeah. Thank you. So I am going to conclude our training for today. Thank you very much for attending. Is there anything you would like to do a bit differently? Anything you would like to change? You can't ask to change the trainer because I will be very unhappy if you will do that. Other than that, if there is anything we can change, I am happy to do that. So is everybody happy with this style of being taught? Okay. Thank you very much. And hopefully see you tomorrow, same time. And we will be talking about framework analysis approach and how we are going to analyze the transcriptions which you are going to do for your homework. Don't forget that. Take care. Bye.
Thank you.
Pragya, you and Nida are going to stay behind for 10 minutes. Thank you very much.
Stay well.
Thank
Thank you,
you.
Nadia.
Bye-bye.
I'll keep the recording going
Thank you.
on. Yeah.
Or Pragya, you can record on your mobile or whatever you decide yourself how because you will need that recording.
Yeah.
Also,
And
if
if you want
you
to,
can stay for
We can
5
continue with this.
seconds,
sorry,
I just
Nida.
want to take a photo.
Oh, Nabi, can you show your face?
Nabi, yeah.
Yes, thank you.
You are not there, Nida.
Okay.
Nida?
Okay. Yep. Okay, thank you.
So
Bye,
great.
Ji.
So see you all of you tomorrow. So
Bye-bye.
Pragya, Nida, you so that she has access to the recording for the transcription.
Yes.
Yes, Dr. Siam, and also the recording from our role play. How would we access
That's a very good question because we didn't think
or
this
maybe
through.
I have the first part of it, so I can just transcribe it for today. Then.
Probably, yeah. Try and do that, but we will ask Arslan if we can quickly have these recordings shared with you. Because I think it should be quite easy to be accessed. They will be in the MP4 format, so you'll probably have to listen in and forward and see where your interviews are placed. So Nida, you can. I'll email Arslan, but just keep a note of this, Nida, so that we can ask Arslan to share this today's session through OneDrive or whatever he uses, right?
Sure,
So
Doctor.
yeah, so I'll mute myself and I will stop the video from my end once you are done. Just let me know because I think, am I recording the session or Nida,
No, the recording is ongoing with both of us. You can just make me host.
I don't want if I step out and the whole thing goes.
No, nothing will happen. It will remain here. Okay.
You
Okay.
already have the co-host permissions.
No, you just while leaving, you just need to make me host, not as a co-host.
So make the host. There you go.
Yes.
Great. So thanks, Pragya. Thanks, Nida. See you tomorrow. I will
Thank you.
sign off.
Thank you.
Hafiz.
Bye.
Okay, Pragya. So
So do we need
will
to
you
pause
be
first? Do we need to pause
okay?
first?
I just need to know, Pragya, let me just stop the recording first because I don't want to lost all of the recording of this day. Okay, just wait for a while.
Yeah.